Welcome to the Postpartum Care class. My name is Melissa, and I am the Discharge Coordinator of the Postpartum Unit at the University of Washington Medical Center at the Mountlake campus. The purpose of this class is to outline the steps in our discharge process to help you know what to expect as you get ready to leave the hospital. I will also describe the normal physical and emotional changes of the postpartum period and outline the perinatal warning signs for you. Finally, I will provide you with some helpful resources so that if you have questions or concerns once you're home, you know who to reach out to and how to contact them. The content from this class has been developed from your postpartum purple book titled A New Beginning. Page numbers are listed on the top of each slide for easy reference. It may also be helpful for you to write down any questions that you have from the class for later review with your nurse. The most important page in your purple book is the last page, which lists the perinatal warning signs. I encourage you to review this page of your book. Let's get started. During the class, I will refer to the person who gave birth as the postpartum person. This list includes minimum tasks which are completed prior to discharge from the hospital. You may have other tasks which also need to be completed before you leave. Your nurse is the best person to speak to about this. On the day of discharge, the OB resident or certified nurse midwife and/or attending will come and talk with you to make sure that you're meeting all of your medical needs for discharge. Next, your nurse will come and take your vital signs, perform an assessment, and offer you medications. This postpartum care class reviews all of our standard care instructions. Finally, the discharge coordinator or your nurse will provide information specific to you, such as your follow-up appointment and medication information. You will also receive a printed packet containing this information. We also offer discount parking coupons at our front desk on our unit. Please pick one up before you leave if you have a vehicle parked on site. Now we will discuss the postpartum period, which refers to the 6 weeks after giving birth, in which your body will slowly return to a non-pregnant state. Many body systems are affected by pregnancy, and there are lots of physical and emotional changes that happen during this time. In addition to these changes, you're also recovering from the birth process. This is a lot to deal with, and you're not expected to handle it alone. Please be kind and patient with yourself and ask for help when you need it. Most importantly, pay attention to what your body is telling you. The postpartum discharge coordinator will assist you with scheduling all follow-up appointments. Please plan ahead to attend these important appointments and call to reschedule if you cannot make it. Now let's talk about normal pain after giving birth. Some discomfort after birth is normal. If you gave birth vaginally, it's normal to experience some perineal discomfort and swelling for a few days. Usually, this pain is described as a throbbing or aching pain. Your perineum may be swollen and tender to the touch. It's also normal to experience a slight stinging sensation upon urination from cuts in the tissue which may have occurred during delivery. If you gave birth via C-section, it's common to experience a deep aching pain, burning or stinging around the site of surgery, and a stretching or pulling sensation as you change positions. Additionally, many postpartum patients experience uterine cramping, especially while breastfeeding or pumping milk. This is the uterus contracting to reduce its size and return to your pelvis. The more births you've had, the more intense the cramping pain can be. It's an important goal to ensure that your pain is well managed before you leave the hospital. Before you go home, you should feel that you can meet your basic needs. Please speak with a member of your healthcare team if you have concerns about pain management. Let's discuss some ways in which you can manage your pain once at home. Every person's body experiences pain differently, and each birth experience is unique. I will provide some general guidelines for you, but it's important to listen to your body and do what feels right for you. Most postpartum persons will take medications anywhere from a few days to a few weeks after birth. Our preferred medications are extra-strength doses of ibuprofen and acetaminophen, also known as Tylenol. If you cannot take one or both of these medications, an alternative pain management plan will be worked out with you. Each of these medications can be taken every 6 hours. Do not take more than the recommended dosages. You can also stagger your medications for maximum around-the-clock pain coverage, by first taking one medication and then 3 hours later, the other. You can see a sample schedule on the screen. Ibuprofen tends to be more effective, so if you're feeling a bit of pain but don't feel like you need both medications, choose to take the ibuprofen. When you're ready, you should slowly taper your medications down, beginning by decreasing your Tylenol dose to 1 tablet instead of 2. If this effectively manages your pain, you can continue to take just 1 Tylenol until you feel ready to stop taking it altogether. And then you can begin to decrease your ibuprofen doses as well. If you're also experiencing uterine cramping, a heating pad or warm blanket can help with these pains. If you're experiencing vaginal discomfort, there are several options for you. You can use ice packs and witch hazel pads to reduce swelling and to soothe your perineum. Dibucane cream is a temporary numbing cream that is particularly helpful if you have sutures. You can apply it before using the bathroom to prevent stinging while urinating. These medications are part of our standard discharge prescriptions for you to take home. They're also available over the counter should you need more. If you had a C-section, you will also be sent home with an opioid medication called oxycodone. This medication is safe for breastfeeding in small amounts and is appropriate for a person who's had major abdominal surgery. Oxycodone is designed to bridge the gap between your scheduled medications. For example, if you took Tylenol at 12 p.m. and will take ibuprofen at 3 p.m., and you experience pain at 1 or 2 p.m., that would be an appropriate time to take this medication. Oxycodone is taken on an as-needed basis. Most postpartum persons will only need to take this medication for a few days after returning home. Oxycodone does an excellent job of preventing additional pain due to increased activity. If you know that you will be getting in and out of the car or going up and down the stairs, taking oxycodone in advance can help keep your pain at a baseline level, even though you're moving around more. Now let's talk about pain that's not normal. You should notify your provider if you experience pain that is new or different from what you've been feeling here in the hospital. Pain that is constant without relief, or any pain that is unusual in nature. Some examples of unusual pain, which can be associated with complications after birth, are chest pain, calf pain, a headache that won't go away with rest or medication, or right upper quadrant pain. The woman in the picture on your screen is showing you the location of right upper quadrant pain. It's important to slowly increase your activity levels. Don't try to do too much too fast. Ask for help when you need it. No heavy lifting for 6 weeks, and that includes anything heavier than 10 pounds. This is important to keep your sutures intact and give your uterus time to heal. If you had a C-section, please do not drive for 2 weeks or while continuing to take the oxycodone medication. Each postpartum person will also be on pelvic rest for 6 weeks, which means nothing in the vagina such as tampons, douching, or sex. It is also important to walk small amounts frequently in order to circulate your blood and prevent dizziness. Many people report that their pain is better controlled as well. Small amounts of frequent movement also help reduce swelling in your legs and feet and prevent it from getting worse. Some swelling is normal and usually starts to get better around day 3 after birth. It's helpful to elevate your legs when sitting or lying down. It is okay to resume a regular diet unless you've been instructed otherwise by your provider. Plan to consume extra calories if lactating in order to support yours and your infant's nutrition. Stay hydrated and consume iron-rich foods such as green leafy vegetables, red meat, beans, and fish to help rebuild your red blood cell supply. If you are taking a prenatal vitamin which contains iron during your pregnancy, it's a good idea to resume taking it for a while. We also recommend continuing to take a daily dose of Miralax to prevent constipation until you've reestablished a normal bowel movement pattern. Miralax is a stool softener and a mild laxative, which is taken to make sure that your stool is easier to pass. It comes in a powder form that you mix in the beverage of your choice and drink up to twice a day. In addition, you can take a mild over-the-counter laxative such as Senna if needed. Call your provider if you experience any nausea or vomiting, or if you're not able to have a bowel movement by 5 days after birth, despite taking Miralax twice a day and at least 1 dose of a mild laxative. It's important to urinate often. When your bladder is full, it can block your uterus from moving back down into your pelvis and cause discomfort. It's best to put yourself on a bathroom schedule every few hours to urinate, whether you feel like you need to go or not. You can use the perineal bottle to rinse off and to dilute your urine. It's important to know what normal bleeding is after giving birth. If you had a vaginal birth, it's common to experience a normal period in terms of color, flow, and consistency for a few weeks. After that, you may have some light spotting or pinkish discharge. If you had a C-section, intermittent bleeding with increased activity is normal. You should notify your provider if you soak through one of the pink perineal pads in an hour or less, pass any blood clots larger than a golf ball in size, or if you have any foul-smelling discharge. If you had a C-section, it's important that someone takes a look at your incision every day to make sure that it's healing and that there are no signs of infection. If you're unable to see the incision yourself, ask someone to take a look at it for you. It's a good idea to cleanse around the incision every day to remove bacteria which grows on your skin. Don't scrub the incision directly, but let warm soapy water run over it and then pat it dry with a clean towel. The steri strips which are on your incision will not come off on their own. You should remove them in the shower about 7 to 10 days after birth. When inspecting the incision, you should notify the provider if there's any separation in the wound, swelling, if it is warm or tender to the touch, draining pus or blood, has any redness, or if it just looks like it's not healing. If you're breastfeeding or pumping milk, it's important to pay attention to the health of your breasts and to take good care of them. Breast milk is supply and demand. The more frequently you stimulate your breasts, the faster your milk will come in and the larger your milk volume will be. Try emptying your breasts often and well, a minimum of 8 times a day. You can also hand express or pump to tell your body to make milk. We expect your milk to come in around day 3 or early on day 4 after birth. It's normal for your breasts to feel full and heavy or hard and lumpy as your milk comes in. You can relieve discomfort by massaging in the direction of milk flow prior to feedings and applying ice afterwards. If you're not breastfeeding, please talk with your provider about options to prevent milk from coming in and/or to dry up your milk. Please talk with your OB provider or a lactation specialist if you have concerns about feeding, milk production, or your nipples. Also call if you have any symptoms of mastitis, which is an infection of the breast. This usually starts with a hard, painful lump which does not massage out with feeding. You might notice some swelling or redness and also experience flu-like symptoms such as fever or chills. Antibiotics are required to treat this infection. Up to 80% of new parents experience negative feelings or mood swings after giving birth. This is normal and related to changing hormone levels. It's often referred to as the baby blues. What it looks and feels like is bursting into tears for no reason, or getting your feelings hurt easily, feeling frustrated or impatient when others try to help you, or feeling anxious, nervous, or worried about small details. During this time, you're also processing your birth experience and reconciling it with what your expectations were. These emotions usually level out by about 2 weeks after birth. This is an isolating time to be a new parent. Rates of postpartum depression in the community are currently high. Many of our normal support networks have been affected by COVID, but you're not alone. Please call for help if you find that it's difficult to meet your basic needs such as eating and sleeping due to sadness, or if you have any thoughts of harming yourself or someone else. Let's review the perinatal warning signs that we've discussed throughout this class. Remember that these can be found in the last page of your purple book, and you can even rip this page out and tape it up for everyone in your household to see. If you experience any of the emergency conditions listed in the red box, please call 911. These items are chest pain, shortness of breath or difficulty breathing, seizures, or thoughts of self-harm. If you experience anything in the yellow or orange box, please call your healthcare provider right away. If the clinic is closed or you can't get in touch with your provider, please call labor and delivery. I will provide that phone number to you on the next slide. Things that you'll call for are heavy bleeding, passing large clots larger than a golf ball in size, concerns about your incision, having a red or swollen calf, fever for any reason, or symptoms of a condition called preeclampsia. Preeclampsia results in elevated blood pressure, and this can happen to any person after giving birth, even if they've never had high blood pressure before. If your blood pressure becomes very high, it could become life-threatening. Symptoms of preeclampsia are a headache that will not go away with rest and medicine, which may also be accompanied with visual changes such as blurry or double vision, a sharp stabbing sensation in the upper right part of your stomach, or swelling of your hands and face. If you have access to a blood pressure machine, you'll want to notify your provider if your blood pressure rises above 140/90. Here's the phone number for labor and delivery, which can also be found in the back of your purple book. For urgent concerns up to 6 weeks after giving birth, you can call labor and delivery if you cannot reach your provider. This slide offers some additional health resources regarding the warning signs associated with complications from birth. These are not included in your purple book. And here are some emotional support resources for you. The Perinatal Support of Washington offers many options for coping with emotional changes. They have support groups, counseling, and a warm line, which you can call anytime. Their contact information is found in the inside cover of your purple book, on the purple flap at the bottom. Also, the Program for Early Parent Support, known as PEPS, is a community-based support service which groups families in the same geographic area together to support each other through the early stages of parenthood. In the inside cover of your purple book, you will also find a list of breastfeeding resources as well. For example, there are several community-based support groups available to you. The Global Health Media videos and La Leche League are also great resources for more breastfeeding support. This concludes the postpartum care class. Keep up the amazing work, take good care of yourself, and let us know how we can best support you as you prepare to leave the hospital.